Imagine a newborn entering the world covered in thick, diamond-shaped plates of skin, so tight they pull the face and body into painful distortions. This is Harlequin Ichthyosis, often called the saddest skin disease in the world, and it's as heartbreaking as it is rare. In the next 20 minutes, I'll walk you through the shocking reality of this condition, from its genetic roots to the daily struggles it brings, and share stories of hope that show survival is possible. By the end, you'll know the signs to watch for, how it's managed, and why there's more hope now than ever before. Stick with me. This is a story of resilience you need to hear. Let's start with what Harlequin Ichthyosis is. It's a genetic disorder, the most severe form of ichthyosis, where a baby is born with hard, armor-like skin that cracks into deep red fissures, resembling a Harlequin clown's diamond-patterned costume. It affects roughly 1 in 300,000 births, meaning only about 7 babies a year in the US face this condition. The tight skin warps facial features, eyelids turn inside out, lips pull open, and ears or noses may barely form. Beyond the visible, it restricts breathing, eating, and movement, making survival a battle from day one. Think of Anna, born in 2017, to Jenny Wilklow, whose parents were devastated when doctors revealed her condition moments after birth. Anna's story, shared through her family's Hope for Anna social media, shows both the pain and the strength of living with this disease. Let's dive into what causes this heart-wrenching condition. First, the root cause, a mutation in the ABCA12 gene. This gene is like a delivery truck for fats that keep your skin's outer layer healthy and flexible. When it mutates, the skin can't form a proper barrier, turning into thick, scaly plates instead. It's an autosomal recessive disorder, meaning both parents must carry the mutated gene, giving their child a 25% chance of inheriting it. Picture 2 puzzle pieces that don't fit. Each parent carries one, but together they create a perfect storm. In cultures with consanguineous marriages, like some reported cases in Syria, the risk is higher. For example, a 2022 case involved parents who were first cousins and had lost a previous child to Harlequin ichthyosis. The mutation's severity matters too. Homozygous mutations often lead to worse outcomes than heterozygous ones. But how does this show up in a newborn? That's our next point. The early signs of Harlequin ichthyosis are impossible to miss at birth. Babies are often born prematurely, covered in shiny plate-like scales separated by deep red cracks. These plates pull so tightly that eyelids flip outward, ectropion, exposing the eye's red lining, and lips stretch open, eclabium, making feeding a challenge. Ears and noses may appear underdeveloped or fused to the head, and hands and feet can look like mittens due to tight, constricted skin. Imagine a suit of armor that's too small. It restricts breathing, risks infection, and leaves the baby vulnerable to dehydration and hypothermia. In 1750, Reverend Oliver Hart described a baby in South Carolina with skin cracked like fish scales and eyes like lumps of coagulated blood, a haunting image still accurate today. These signs demand immediate care, which leads us to the complications that follow. Now let's talk about the life-threatening challenges. The cracked skin destroys the body's natural barrier, letting heat and water escape, while inviting bacteria like Staphylococcus aureus. This can lead to sepsis, a leading cause of death in these infants. Restricted chest movement causes respiratory distress, and the tight mouth makes sucking or swallowing nearly impossible, often requiring tube feeding. Dehydration and hypothermia are constant threats, as the skin can't regulate temperature or fluids. For instance, a 2016 case in Nagpur, India, saw a baby survive only 2 days due to breathing difficulties. Survivors face ongoing issues, recurrent infections, joint contractures, delayed growth, and even hearing loss from skin-blocking ear canals. Socially, the visible differences can lead to isolation or stigma, adding emotional weight. But who's at risk for this condition? Let's explore that next. Risk factors center on genetics and family history. If both parents carry the ABCA12 mutation, their child has a 1 in 4 chance of developing Harlequin ichthyosis. Consanguinity increases this risk, as seen in cases like the Syrian family mentioned earlier. The condition affects all sexes and ethnicities equally, with no racial predisposition. Prenatal factors also play a role. Abnormal amniotic fluid or intrauterine conditions can worsen symptoms, though they don't cause the disease. A 2015 study noted that 3D ultrasounds can spot signs like a flattened nose or open mouth by the second trimester, but genetic testing via amniocentesis or chorionic villus sampling is the gold standard for prenatal diagnosis. Families with a history of HI or consanguinity should seek genetic counseling. So, how do doctors confirm this condition? That's our final core point. Diagnosis is usually immediate at birth due to the striking appearance. Diamond-shaped scales, red fissures, and facial distortions scream Harlequin Ichthyosis. Genetic testing for ABCA12 mutations confirms it, though a skin biopsy can also show abnormal keratin layers under a microscope. Prenatal testing is key for at-risk families using fetal DNA from amniotic fluid or villi. In a 2011 case, a preterm baby was diagnosed instantly based on her armor-like skin and started on life-saving care. Early diagnosis allows for quick intervention, which is critical because without it, many infants don't survive the first week. Now let's move to what can be done to manage this devastating condition. Here's the reality. There's no cure for Harlequin ichthyosis, but advances in care have transformed outcomes. Newborns need immediate neonatal intensive care in high-humidity incubators to prevent dehydration and hypothermia. Nurses apply emollients like Aquaphor every few hours to soften scales and seal cracks, reducing infection risk. Daily baths with gentle exfoliation help shed the thick plates, and antibiotics are often used proactively. Oral retinoids, like acitretin at 1 dmec a day, are game changers. They speed up scale shedding and improve survival rates to 50 to 90% with early use. For example, Anna from the Hope for Anna story survived thanks to intensive NICU care and retinoids. Long-term survivors like Stephanie Turner, who lived to 24, and became the first with HI to give birth. Manage with daily moisturizing, physical therapy, and high-calorie diets to support rapid skin turnover. Support groups, like those from the Foundation for Ichthyosis and related skin types, offer emotional and practical help. You're not alone in this fight. Let's wrap up with hope and action. Harlequin ichthyosis is a brutal condition: thick, cracked skin, life-threatening complications, and a genetic cause that's hard to escape. We've covered its ABCA12 mutation roots, the shocking newborn symptoms, the risks of infection and dehydration, genetic risk factors, and how diagnosis happens at birth or before. Most importantly, intensive care, retinoids, and ongoing skin management give babies a fighting chance, with some living into their teens, 20s, or beyond. If you're pregnant and have a family history, ask about genetic testing. If you know someone affected, connect them with support groups like FIRST. Share your thoughts in the comments. Have you heard of Harlequin ichthyosis before? Subscribe and hit the bell for more stories of resilience and health breakthroughs. Thanks for watching, and let's keep spreading awareness together.